think we're in a great place. I think we're developing and growing. We're caring, learning and growing. I think we've got a lot of work to continue to do, but we've made a lot of progress on a lot of really good areas. We've got financial challenges, but any NHS organisation has, but we've got committed staff who are working with us to overcome those.
One of the first things that struck me about the staff here was their compassion and commitment to high quality patient care.
And really see them, how they are working under difficult circumstances and how well they are performing.
It's having a team on board that are so dedicated.
We've got the new staff charter, we've got the new visions and values of the organisation.
For the trust to progress, the staff need to be healthy, happy and able to, have a good balance.
We've got ourselves as a caring, learning, growing organisation.
Staff are our greatest asset and we need to look after them. So there's been lots of initiatives, lots of physical ones such as walking groups, running groups, step challenge, which a lot of people have taken quite seriously. And there's been lots of things dealing with mental health as well. So for example, managing stress, how to recognise stress, mindfulness courses, yoga, all sorts of things. So that will continue into the future, but there's been a big investment in that in the last year.
It's been a real eye-opener and I guess a testament to working with people who work in the NHS. It's been great really in that sense.
At the moment we're focusing on promoting volunteer roles across the Trust.
I have an understanding of a lot of the clients of what they're going through as well.
Research does give you that hope of being valued again. We have to normalise talking about research.
People like Wendy just help us make it seem more real.
The very scale of the services that we provide obviously a very comprehensive mental health service, but we also provide primary care services, and that's grown with our GP practices, alongside health trainers, public health, health visiting, school nursing, and child and adolescent mental health services. So there's a lot of different services that we provide.
We've won that tender to open that inpatient service, which is why our next year is a very exciting, a very interesting prospect.
Well, it's been a brilliant first 12 months. I think the main challenge would probably be telling staff about the charity and making sure that everyone knows that the charity is part of them and everyone can make an input into delivering these lovely enhancements to the service.
What we've been asked to deliver is an 11-bedded unit, of which 9 of the beds will be general adolescent, 2 of the beds will be psychiatric intensive care beds, which is quite a huge shift from what nationally is offered for young people.
Working with the CAMS new inpatient unit that's going to be at Walker Street, and we're about to launch a very exciting fundraising programme to raise a significant amount of money to enhance the service there.
This year we did a research conference. We've never had one before and it was brilliant.
Things like the Recovery College, to me, phenomenal.
Partnership working has been such a big surprise. It's been so positive working with Humber Care.
We're continuing on our continuous service improvement journey, putting the patients and their families at the very heart of their care and our work.
Carers are able to come down to the crisis pad with whoever they're caring for if they are in distress, and it's about being able to equip them, the carers, with the techniques maybe themselves, or if they need a little bit of support and intervention, we can deliver that as well.
Since we started the Circle of Wishes process, we've had over 140 wishes and we've delivered on 80% of those. And one of the most exciting projects that we're working on at the minute is a refurbishment of Granville Court Gardens in Hornsey.
In GP practices now we've got different practitioners, emergency care practitioners, and we've actually been able to get a piece of equipment which is a tablet ECG machine that an emergency care practitioner who is in the surgery can use.
Nationally and locally there's an interest and a need to really target prevention.
My ambitions would be that this training programme would be something that all frontline services across Hull and East Riding could be part of. We're all getting the same messages and all have the same understanding of how to deal with these populations of people.
We recently looked at our environment and decided it was time for a change. The first strand of the success was the patient participation and feeling it's their mural, and that was the important thing for me, that it was their environment, it belonged to them.
The geographical size and the very nature of the services creates its challenge but also its opportunities for the organisation going forward, and one that I really relish.
I think the new development is going to be, very beneficial to the, not just to the staff, but to the community as well.
So I think we are in a really positive position, but we need to sustain that going forward.
It's about asking a question, how are you? It doesn't matter, whether you're a member of the public, whether you're a carer, whether you're a family member, just a visitor onto our site, especially our staff. It's an important question that you ask the question, but you need the answer, you need to listen to the answer.
Thank you, staff. You're doing a wonderful job. We live in awe of all the work you're doing.